Hello and welcome students. I, Dr. Adil Patel, welcomes you for the discussion of the topic absorption of drug from non-per-oral extravascular routes. We are discussing this topic as a part of the subject biopharmaceutics and pharmacokinetics. So let us understand what is non-per-oral route. So the non-per-oral means other than oral routes which bypasses the gastrointestinal tract and reaches to systemic circulation. So via these particular routes, drug directly goes into the blood circulation, and by the means of using various routes and dosage forms, we are avoiding or bypassing the gastrointestinal tract. One of the major advantages of administering drugs by non-invasive transmucosal and transdermal routes such as nasal, buccal, rectal, etc. is the greater systemic availability is attainable. So it has been observed that when we are using this non-per-oral routes of drug administration, the possibility of attaining greater systemic availability is very high compared to oral route. In oral route, the biggest disadvantage is the hepatic metabolism, and due to the hepatic metabolism, the systemic bioavailability of drug decreases significantly. Now let us see what kind of routes are available under the heading of non-per-oral extravascular routes. So we have buccal or sublingual route of drug administration, rectal route of drug administration, topical and intramuscular route of drug administration, subcutaneous, pulmonary and intranasal route of drug administration. So these are various routes by which we can administer drug to humans other than oral route or bypassing the gastrointestinal tract. Now let us try to understand the advantages, disadvantages and the basic introduction of individual routes of administration. So first one is the buccal or sublingual route. So the buccal route is mainly used when the medicament is placed between the cheek and gum. One such example of marketed preparation is the dosage form available in the form of buccal patch of glyceryl trinitrate. So glyceryl trinitrate is predominantly administered via the buccal route. The sublingual route is slightly different from the buccal route. Here the drug is placed under the tongue and allowed to dissolve. Example of drug which is administered by the sublingual route is Ergotamine. So there is a small difference between the buccal route and the sublingual route, but the common thing is that drug directly goes into the blood circulation, and thus we are bypassing the gastrointestinal tract and hepatic metabolism. If you see advantages of buccal as well as sublingual route, so it includes rapid absorption of drug into blood circulation, no first pass hepatic metabolism, and thus the bioavailability increases, and there is no degradation of drug because of the acidic environment of the gastrointestinal tract. If you see the factors which are affecting the success of these two routes, So the factors include lipophilicity of drug and the salivary secretions. So these two factors will determine the success of drug administration by buccal as well as the sublingual route. Next is rectal route of drug administration. Now, due to the patient compliance issue, the use of rectal route of drug administration is only limited to pediatric and geriatric patient. So the rectal route of administration is an important route for children and old patients. The drug may be administered as solutions, also known as the microenemas or suppositories. If you see advantages of rectal route of drug administration, so it includes rapid absorption and it also bypasses presystemic hepatic metabolism. The factors affecting the success of drug administration via the rectal route includes the presence of fecal matter, the pH of rectal fluid, the drug irritability, and the surface area which is available in rectal route of drug administration. Next, we have the topical route of drug administration. So here the skin is commonly employed as a site of drug administration for local as well as systemic effect. Semisolids like ointment, creams, paste, gels, etc. are conventional drug forms for topical drug delivery. If you see advantages of skin, or you can say the topical route of drug administration, so it includes the protection of drug from the gastrointestinal environment and also from first pass metabolism or hepatic metabolism, increased patient compliance by reducing dosing frequency, easy to terminate drug therapy by removing transdermal patch. So these are some advantages of topical route. Now let us see the factors which are affecting the success of drug administration via the topical route. So it includes skin condition, the composition of topical vehicle, the application procedure, and external or environmental factors. The next route of drug administration includes various injections, and these injections can be applied to various parts of the body. So mainly four types of injections are very common. Intravenous injection, which is also known as the IV injection, intramuscular injection, subcutaneous injection, which is given in the skin, and we have the intraperitoneal injection. So it is given into the peritoneal cavity of the body in the abdomen region. Now the peritoneum is a thin transparent membrane that lies the wall of abdominal cavity. So these are four mostly used injection routes for drug administration. What kind of factors are affecting the success of drug administration via injection? So it includes vascularity of injection site. Vascularity means the level of blood circulation, the lipid solubility and ionization of drug, the molecular size of the drug, the volume of injection or the drug concentration, pH, composition and viscosity of injection vehicle. The next route of drug administration is pulmonary route. So the drugs administered by inhalation since the large surface area of the alveoli. So basically the drug is administered via alveoli and it directly goes into the pulmonary region, which mainly includes the lungs. So we are directly administering drug to lungs, and from lungs it will directly go into the systemic circulation. Now the advantages we have in case of pulmonary route is that the rapid absorption, just like exchange of gases between the blood and inspired air from the lungs. The lipid-soluble drugs are readily absorbed by passive diffusion. The polar drugs absorbed by pore transport. So basically the pulmonary route of drug administration is suitable for both polar and non-polar drugs. If we see the factors which are affecting the success of pulmonary route of drug administration, so it includes the particle size of the drug, properties of propeller such as vapor pressure, toxicity, and solvent action, effects of drug and additives on mucus viscosity and mucociliary clearance. So these are factors which are deciding the success of drug administration via the pulmonary route. The next route of drug administration is intranasal route. So the nasal route is popular for systemic delivery of some peptide and protein drugs. So these are high molecular drugs, high molecular weight drugs. The advantages of intranasal route of drug administration includes rapid absorption due to rich vasculature and high permeability. Drugs from this particular route reaches the systemic circulation and may cross blood-brain barrier. The factors which are affecting the intranasal route are required high lipophilic drugs, smaller molecule weight is necessary, pH of nasal secretion, and pathological condition. So these are four factors which are affecting the success of drug administration via the intranasal route. The next route of drug administration is intraocular route. So the topical application of drugs to the eyes is mainly meant for local effects such as mydriasis, miosis, anesthesia or treatment of infection and glaucoma. The advantages of intraocular route is that the lipophilic as well as hydrophilic drugs are absorbed via this route. The pH of lacrimal fluid influences absorption of weak electrolytes. The factors which are affecting the success of intraocular route of drug administration includes the rate of blinking shows loss of drug. The viscosity of drug also affect on absorption. So these are factors which are affecting the success of drug administration via the intraocular route. Now in this summary, we can see the various routes of drug administration. the absorption mechanism for that particular route, and examples of drugs delivered or marketed preparations based on this type of non-peroral routes of drug administration. So in case of buccal and sublingual route, the absorption mechanism is mainly passive diffusion and carrier mediated transport. Various nitrites, anti-anginal drug and morphine is delivered by these particular routes. The second route is the rectal route of drug administration. The drug absorption mechanism is passive diffusion. Aspirin, paracetamol and barbiturates are delivered via the rectal route of drug administration. Next is transdermal route, and the absorption mechanism is passive diffusion. So nitroglycerin and lidocaine is the example of drugs delivered via this particular route. Then we have the intramuscular route of drug administration, and the absorption mechanism is passive diffusion, endocytosis and pore transport. Phenytoin and digitoxin are examples of drug administered via this particular route. In case of subcutaneous route, the mechanism is passive diffusion. Insulin and heparin are administered via the subcutaneous route. Inhalation route of drug administration, which is also known as the pulmonary route of drug administration. The absorption mechanism involves passive diffusion and pore transport. The salbutamol and cromolyn are examples of drug administered via this particular route. In case of intranasal route, the absorption mechanism is passive diffusion and pore transport. Phenyl propanolamine and antihistaminic drugs are administered via intranasal routes. The intraocular route has the absorption mechanism of passive diffusion. Atropine and pilocarpine are administered via the intraocular route. And the last route is the vaginal route of drug administration, and the absorption mechanism is passive diffusion. Steroidal drugs and contraceptives are delivered via this particular route. So please go through this video and let me know if you have any query or question. I would be happy to solve your queries. Thank you very much for watching this video. Stay safe and have a good day.